Welcome to our podcast, An American Health Revolution. Thanks for being here, and thank you, Dr. Richard Margolis, for joining us today.
It's my pleasure to be here.
We were talking offline before, Richard, about the fact that this is year 250 for the United States, and in our title is the word revolution. How coincidental is that, right? And I was mentioning to you that the word revolution isn't necessarily something that I naturally gravitate to. It's a word that I may not have even been comfortable using. But when it comes to the declining health of America and Americans and the threats that are being posed, I think that the word revolution really does apply, and we have to use it in a peaceful way, of course. But the wake up call is real, right?
The wake-up call is very real, and revolution really speaks to the importance of change, that something that's been going on has not been working, and we need to make substantial changes for there to be improvement in the lives of everyone.
Absolutely. The numbers speak for themselves. Go to our website, AmericanHealthRevolution.org, and you'll see the degree of the chronic disease epidemic in this country. One of the topics we're going to delve into today is that of informed consent. And it's a topic, when you use those two words together, a lot of people tend to get a reaction, Richard. You know, what is informed consenting? How much should I rely on my doctor? There's a lot of nuance there, and the phrase has very specific meaning today that I think is really important for our audience to understand. In a perfect world, and I'll set the table here just for a second, then turn it over to you. In a perfect world, doctors are motivated by patient-first care, the Hippocratic Oath, their role as fiduciaries. They use elevated levels, elevated standards of care for their patients, and then they discuss the risks of certain treatments or procedures with their patients or their patients' families, and together they come to the best possible decision. This, of course, all presupposes that the doctors themselves have access to the best possible information, objective, science-based, patient-first care, and that this is unencumbered by other motives. And I think it's not too much of a stretch to say today that those motives have become a little more profit-centered than they are patient-centered. And this is causing problems in our healthcare system. It's adding costs to our healthcare system. And so informed consent becomes that much more critical for patients and their families to understand and take the lead on, right? So with that, I'd like to ask for your interpretation of what informed consent is, and then we'll get into a couple of examples. Thank you.
Well, informed consent has ethical implications, but there are legal requirements for informed consent for a patient to have the information that they need in order to make the best choice for their own health care. And so it means that the healthcare practitioner must explain to them what their condition is and what the proposed treatment is, whether it's a surgical procedure or if there's medication, some type of chemotherapy, and what are the alternatives to treatment. What about not having any kind of treatment at all, or some alternative therapies that could be helpful too, so that among these different choices, the patient can make a true reasoned decision about what is best for their care. Now, part of that is that the healthcare practitioner, the doctor, needs to decide that the patient is competent, they could understand the information and use it in a meaningful way. And if not,
Sure.
there could be other people, family members, or someone else who becomes a decision maker for the patient who's not competent. But there are many, many malpractice cases out there. And as a matter of when people were not informed of some untoward event, some side effect, some uh, complication that should have been explained to them, because had they known, they might not have chosen to agree with what the doctor was proposing.
And in the case of medicine, that can often be some deeply buried language in an insert somewhere, right?
It can. I could tell you my own personal experience with my father-in-law, and this happened a number of years
I would
ago.
love to hear that.
Uh,
Yes.
I would call him periodically, see how he was doing, and one day I called him up, and he said, "Well, I'm not doing so well." Oh, what's the matter? Well, I have an infection in my foot. And I thought, oh, he was an older man. He was in his 80s at that point, and he had uh, some decrease in his peripheral circulation. And I asked him what he had done, and he went to one doctor. Then I told him he had to go back to his primary care, who he had not consulted with, and the primary care. But I told him most of all, uh, whatever you decide, before you agree to anything, talk to me, because then I would be able to, you know, give him important information so he can make his own decision. Well,
Mhm.
he went to see his internist, who told him that he was referring him for surgery. And I thought, well, that's really interesting. And I asked for the name of his internist. I called him up. The internist was very nice on the phone. He was happy to speak with another physician. And he told me that he was recommending my father-in-law for surgery, and uh, he knew the surgeon very, very well. They used to be neighbors, and now they were friends. They were golf buddies. And so I asked him for the name of the surgeon. I gave the surgeon a call, and the surgeon said, "Oh yes, this is." He described the procedure. My father-in-law had limited circulation. He was going to take a vein from elsewhere in his body and replace it in his lower leg to improve the circulation. And I said to him, "What about alternatives? Or how about balloon angioplasty to open up the blockage so he can have better blood flow?" And he said to me, "I can't tell you about that." And I was really surprised. I said, "Why can't you tell me?" Well, he said, "I don't do that. That's not what I do." Well, who does it? An interventional radiologist. And that was new to me too. I didn't know that was done by an interventional. But when you find out, you learn things. And I told him, "Well, thank you for the information. I just want you to know that there's no need for you to schedule the surgery tomorrow." He wasn't wasting any time. The surgery was set for the next day. And I said,
Don't give them a chance to think.
no, no, it was done really quickly. And then I got in touch with the interventional radiologist. And the interventional radiologist said, "Wow, I'm really glad you called, because it was right there in my report that he was a perfect candidate for this." And what were the risks? The risks were really very minimal. It was a very safe procedure. And I had asked the surgeon too, what would be the risk for taking someone in their 80s and operating on them? What was the risk of morbidity, complications uh, from the surgery, or mortality, that he would die as a result of the operation, or complications from the operation? He said, "Well, I can't tell you that." And I thought, well, how in the world could he make an informed decision without knowing what the risks were or the alternatives were? And sure enough, he went to the interventional radiologist. He had the balloon angioplasty done. He had, and he recovered beautifully, and he lived another 10 years after that in his own home. And he was very grateful to me that, I had interceded, or else he would have undergone the surgery, and then he would have had, very complicated recovery if he was lucky enough not to have any problems. But I was aware of all the things that could go wrong.
Right.
And everybody needs to really understand this. I think Americans now understand that they don't want healthcare people telling them to do this or do that. It's very condescending. They want to make their own decisions, and they want to have the information that they need to make that decision.
A lot of this goes to the incentive structure, does it not? And how are the incentives aligned? And are surgeons incentivized to perform surgeries versus advise their patients in another direction, or at least consult with them accordingly, right? You're talking about a personal example, and thank God your father-in-law had an advocate like you in his corner there to help guide him to the best decision for him, right? Not too many people have those advocates. And we know in history, and perhaps even today, but let's talk about the obvious example. I know you're familiar with it. The institutionalized advantage that was taken of people. What do we have here? Let's see. Let's choose the untreated syphilis study at Tuskegee. I know a lot of people know about this, or they know something about it. Richard, you're very familiar with it. This is an institutionalized example of, medical tyranny, I'm going to call it. Tell us.
It's a really shocking story. And in going through it, even now, even though I've known about it for a long time and I've read through it many times, it's still very, very shocking that in 1932, the United States Public Health Service decided that they were going to study untreated syphilis among 400 African American sharecroppers around Tuskegee, Alabama. And they didn't tell these folks that they were not going to be treated for syphilis. Now, back then, the treatment for syphilis was not very good. This is before they came up with antibiotics to treat syphilis, and people were treated with arsenic and mercury, which we know are poisons. But the idea of the poisons was, well, if we could keep the host, the person alive, then the toxins could kill the poisons before killing the person. But because of cost and their decision not to actively treat these men, for years and years, they were lied to, and they were told they were getting treatment when they weren't.
They were getting a placebo?
They were periodically they would have lumbar punctures to see if they still had an active syphilis case, and they were told that was a treatment. Or they were given aspirin, and they were told that was a treatment, and they knew that was not the case. It took a whistleblower in 1972, 40 years after the experiment started, to finally bring this to the attention of Senator Ted Kennedy at that time, who declared that it was outrageous and intolerable. And they put an end to it. And all during that time, even though that penicillin had been identified as a treatment for syphilis, years after the experiment started, no one was treated. And not only weren't they treated, their wives weren't treated, because many of the wives ended up getting syphilis. and pregnant women can give syphilis to the babies they're carrying during the pregnancy or during birth, and they weren't treated. So, and the U.S. Public Health Service didn't offer any compensation for what had happened to people, but fortunately they did sue, and at least the people who survived and their heirs got money from the lawsuit.
Yeah.
And it's an example that not long ago in our history, this is 1972, that this happened. It was permitted, it was sponsored by the government and paid for by the government. And the government went along with it. And in terms of the topic of informed consent, that there was no informed consent. People were not told what their condition was. They were not told what the available treatment was or the alternatives. They were absolutely lied to, and it was covered up for years and years. This is a clear example of how there's been, how the government unfortunately has not been honest with people at times and did not follow the ethical requirements or the legal requirements of informed consent.
Now, let's tie this into what we call an American health revolution, corporate capture of the government and its policies. There's a lot going on today. It's not like our system has suddenly developed a conscience, Richard, right? This goes back to the founding of our nation, right? The Thomas Jefferson quote: "If people let government decide what foods they eat and what medicines they take, their bodies will soon be in as sorry a state as are the souls of those who live under tyranny." Yeah, and so this issue of corporate capture of government agencies, Richard, it's almost like, they're working together to undermine human health and dignity. This Tuskegee example, is a case in point, but I think a lot of this is going on today. There's just countless examples of people's health being undermined, and we have just to give you an example, to give our audience an example, and I know you know this, the size of the criminal penalties that have been paid by the industry. It's since 2000. I believe, I don't know what the number is now. This was a number from last year, I believe, $126 billion in fines and penalties, led by Johnson & Johnson, but certainly almost any major pharma company can take their share of that pie. And to them, this is just the cost of doing business, is it not?
Unfortunately, it does seem to be the cost of doing business, even though the penalties are so great. You can see it's practically 127 billion with a B, billion dollars since year 2000. But Big Pharma is making so much money, they could write that off as essentially a business expense.
They do.
This is
tax benefit, yes.
Cost of business. And Eli Lilly recently became the first $1 trillion pharmaceutical company. So you can see it's one of the top, I think it's maybe the second or third or fourth biggest corporation that exists. You can see just how big the profits are. And
it's in the top 10 market value. It's in the top 10 globally. The first pharma healthcare company to crack the top 10 for sure. And it's if I can just interject this side note, the latest surge in the stock price that got to that had the company breach the $1 trillion market value level was done just over a period of 2 weeks, right after the CEO of Lilly was in the White House, in the Oval Office, giving a presentation with a GL1 patient whose name was withheld from us standing there behind the president. The man was a GL1 patient, and he fainted.
Oh,
They did you hear about this? They never divulged the reason. They never divulged. But here was a man who was a GLP-1 patient, and it begs the question: why was this man on a GLP-1? He was not overweight. He was not the prototypical GL1 profile, but here he was standing in the Oval Office, and he passed out. And I remember a whole big to-do was made. And just a matter of days later, Lilly stock just kept going up and up and up and crossed over $1 trillion. And I find that to be a little more than ironic. Yeah.
Well, there are two big blockbuster medications that have recently come out.
Yes.
Mounjaro, which is for
Right.
type 2 diabetes.
Right.
And then Zepbound is specifically for weight management, and also it's indicated for obstructive sleep apnea. So those are, there are millions of people with those diagnoses. These are blockbuster medications that truly help people to lose weight, even though there may be serious complications that go along with the medication. That people, again, getting back to informed consent, they need to know. I've read studies that up to 50% of the weight loss is lean muscle mass, meaning that half the weight you're losing is muscle. So if we're losing a lot of muscle, then we're actually burning fewer calories.
Right.
And another major side effect that people need to be aware of is that these medicines slow the digestion rate and can cause a condition called gastroparesis. These are all important things to be informed of before going on a GLP-1 agonist.
And in the interest of weighing risks and benefits, there are obviously going to be many cases where these drugs are appropriate. But it seems like the industry and then the agents of the industry, which goes right down to the medical professionals, they seem to be in this posture of asking for forgiveness rather than permission, where they've taken the precautionary principle and inverted it and said it's not up to us to prove that it's good for every patient. And the question is, do they then start to undermine their own fiduciary role in working with a patient? And I know you may have some thoughts about the role of a doctor as fiduciary, the precautionary principle, and how this relates to the issue of informed consent.
Doctors used to be the most trusted physician of any professional. And the unfortunate thing is that over time, especially recently, people trust less and less in their doctors and their healthcare practitioners. Doctors want to reclaim that trust that they've had in the past with patients, and they want to engage in a process of shared decision making to allow the patient really to have all the information they need and to make the decision, including what are the risks, what are the alternatives, and how people can be helped if they've gained weight over time to make changes in their lifestyle, in their diets, in their ability to move more and perhaps exercise or start to walk regularly, that will improve their general health and support their recovery from whatever condition they may have.
They're going and they're targeting younger and younger people, right? With this drug. It reminds me of the whole Joe Camel thing with tobacco, where because once you start taking some of these drugs, Richard, and you get injections, you have to stay on them, right? For otherwise the benefit disappears right away.
Yeah. There was a recent study about how quickly people regain their weight when they get off of the medicines. It doesn't take that long. Perhaps some people are maybe in a worse condition than they were before. It's been, some people have compared it to the TV show The Biggest Loser, where the contestants were put on special diets, and they had to exercise continuously, and then the show went off the air, and these people were followed up many years later, and they had regained their weight, and they were actually worse off than they were before. And it's a cautionary tale that we don't want people who are taking these medicines to just end up at some point being worse. And many people end up stopping the medicines because of side effects that they're experiencing.
Sure, including things like nausea, right? One day soon, we're going to do, as some people may know, we're going to be doing a series of podcasts together, and I would love to devote one of them, Richard, to how this system operates and the role of the insurance company, and how the doctors are incentivized via the insurance company to act a certain way, reach certain bogeys, that kind of thing, and how that plays into Medicare as well. I think there's a lot going on there that people don't know about. And in a perfect world, again, we would love to be able to simply trust our doctors, trust the system, that our well-being is taken care of first and foremost. But with the country now spending $4.5 trillion, I believe the number is, annually in healthcare costs, that number is multiple times higher than it was two generations ago. Why is that? Because it's not a healthcare system, Richard. It's a sick care system. I think more and more people are waking up to this. The question is, what do we do about it, right? And the answers aren't easy, but I think it starts with awareness. I really do. This has to be a grassroots. Enough is enough. We, the people, are not going to stand for this anymore. We want true health care that puts the patient first. And I'm not trying to vilify the doctors. There are a lot of great doctors out there. They really do care about their patients. But I think there are also many cases where, unbeknownst to them, they are being misled. They are being given bad information. They are being given, answers to their own questions that may not be geared around the patient. We can talk about the American Association of Pediatrics. Talk about whistleblowers who have the courage to speak out because they do put patients first. What happens to them? They often get vilified, smeared, targeted. Some get their licenses revoked. And that should never be the case, right? We should welcome those voices of dissent as an important element of science, right?
Absolutely. I think you just gave a wonderful definition before why we need an American health revolution. We need to change what has been going on for years, because people have just gotten sicker and sicker, and we're drowning in the debt of healthcare costs. And I completely agree with what you're saying. Look, doctors, nurses, healthcare professionals, they've worked hard in their lives. They truly want to do what's right for their patients. But they have certain influences, and they can only share the information that they have with their patients. And if they're not being given all the information they need, then their patients are never getting that information as well. So if we're totally dependent upon what Big Pharma is telling us about one of their products, and no one gets to see the data, the raw data from the studies that they've done. We only get to see the results that they publish and the explanations that they publish. Then, good doctors may be giving the wrong information to their patients because they don't know the full story. I always think of trying to be a judge, like a judge in a courtroom, listening to all the evidence. They wouldn't hear the evidence on just one side. Uh, they need to hear both sides to make the truly best decision in the courtroom. And we want to be like those judges. We want to hear
Any
not only
any
the
reasonable democratic process would have that, right? Yeah.
absolutely. We need to hear, not only uh, what potentially might be helpful about a drug, but what are the downsides? What what are the other things that I could do besides adding another drug? One of the big problems now, especially among uh, people who are older, is the practice of polypharmacy. More than 40% of people age 65 and above are on at least five or more different medications.
Wow.
And
Wow. And
these
suffering multiple chronic diseases as well.
suffering multiple chronic diseases, and then all of these medications have various side effects that occur that can be amplified by different medications. And then
Hmm. Hmm.
people start getting prescribed more medicine to treat the side effects of the medicine that they're already on. And again, people, doctors, prescribers are well intentioned. They want to do what's right for their patient, but they need and I think there's hope in the future now that they'll start getting better information because they want a feeling of success. They want um, to see their patients get better. It's
Hmm.
very draining for doctors who just see patient after patient who has they have so many chronic conditions that they feel they're just doing their best to try to keep them alive.
I think sowing a sea of confusion seems to be the MO for the from the institutions from the top down. Leaving doctors feeling powerless. The incentives. Here's a chart that I'm going to share that Richard makes me more than a little angry. It tells us that the size of the cancer treatment market is going to double in the next 10 years. Basically, what they're telling us is it's a fait accompli. We're going to have to simply accept it. And I'm looking at those numbers and I'm saying, hey, hold on one second. I'm not ready to accept this. I want us to find what's causing this and treat the root causes of this cancer. That would bring us back to things like the environment, the food, the soil, right? The water, the chemicals. Um,
I just want to comment on that briefly.
yeah.
Doctors are trained to diagnose and treat. Uh, they're not necessarily trained to become researchers and look at what the potential causes are, the root causes of illness. And they're in a position where they're incentivized for diagnosing and treating. Somebody goes to your office, they have a certain set of symptoms and problems, and your job is to diagnose them and offer some kind of treatment, which is usually to ameliorate their problems, to lessen their problems, to focus on their symptoms, and to decrease the symptoms that they're feeling, that they're experiencing. And this brings to mind the whole disaster with OxyContin. Uh, these opioid medications because so many people have chronic pain, and uh, where you really want to know why someone is experiencing chronic pain, and the different things that can be done to really address the root cause of their pain, rather than just giving them an opioid, a painkiller that will um, that will mask the pain And yes, it helps them feel better, but at such a terrible cost. The pharmaceutical company Purdue has been in the news for many years. They
Mhm.
paid more than $10 billion in fines, and they were charged with civil and criminal fines. But even though these companies have paid out billions and billions of dollars, nobody ever goes to jail. They just
No.
pay it, and
White collar.
they're white collar, and it's so Purdue declared bankruptcy. They paid their fines, and then a new pharmaceutical company was created from the old Purdue,
Mhm.
uh, and the I hate to say it, but the doctor who started Purdue, he and his two brothers, who were also psychiatrists, uh, realized that they can make a lot more money in the pharmaceutical business, especially around public relations. They were really brilliant at being able to promote certain drugs so that the pharmaceutical companies could boost their sales of those drugs. And then they decided, instead of doing this for other pharmaceutical companies, these are the Sackler brothers, uh, they would start their own pharmaceutical company, and then they developed numerous pharmaceutical companies, and it used everything that they understood to uh, increase profits. Even though the tragedy of it is that so many people became addicted to
And
opioids,
they knew. They
they
knew.
knew. This is what came out from the investigation, that they knew. They said it wasn't addictive, but they knew from their studies that it was. And they hid the essential data that would have warned everybody about the risk.
And again, I think it comes back to understand the urgency for informed consent as a way to challenge this sort of capture of the system by these corporations and the profit motive. We have to ask questions, and I would love to. When we wrap this up today, I would love to get to solutions. What can we do? What should we be doing? If we're a parent of a child, or like you talked about with your father-in-law, you have an elderly person or a loved one to take care of. What can we do with our doctors? I think many times people they know something isn't quite right, but they're going to trust their doctor anyway instead of asking the questions. And I think that often turns out to be a mistake. Sometimes not, but I think that's one of the things we can address together. Is what can people actually do, right?
Uh, One of the important things to do is to prepare questions before a doctor's visit. Gavin DeBecker, who provided security, has this huge security company, always tells his employees, before you go anywhere, I want you to come up with 10 different questions that you're planning in advance to ask. And I think
Hmm.
that's tremendously helpful for your doctor, because once you're in the office, and they're taking your blood pressure, and things move very quickly, and your doctor only has a few minutes with you, it's easy to be overwhelmed and not really to come up with questions on the spot that you'd like to ask. So you want to sit down, and uh, people,
It,
there's so
it's
much.
a volume business. I'm sorry to interrupt. It's a volume business, right?
It is, and doctors are under tremendous pressure too, to see a certain number of patients and to keep moving, and their waiting rooms are full, and it's very stressful for the doctor. But your job is to take care of yourself. So in advance, if you have concerns, you always come up with questions. You start to look things up on the internet. Is the internet always right? You you can look for AI to provide information. Is that always correct? No, but what it could do is help you think about what kinds of questions you want to ask your healthcare professional and write them down and go into your appointment with that information ahead of time so that you're not overwhelmed with being there. Now, it's going to take more time for your practitioner to spend with you, but if they really don't want to spend the time with you and they're not prepared to answer your questions, then it may be an opportunity for you to look around at someone else who will.
And, we started at the outset today talking about the nation's 250th year, and perhaps halfway back is when the modern medical system sprouted its roots, starting with the Flexner report, and the Rockefellers and Carnegies came in and created the whole system of allopathic medicine, university research. I'm sure you're familiar with all of this. People do not trust the system as much. We want a system that people can trust. That we want people to be able to trust their doctors. We want the doctors to be able to trust the agencies, the companies that provide them with information that is geared around the patient. But because the people aren't as trusting of their doctors, understandably today, there's this movement kind of away from allopathic medicine. Like, okay, I'm going to go in this direction. I'm going to talk to this doctor. I'm going to take this vitamin regimen. And I'm seeing all of these now health experts appear all over the place. And I have to be honest with you, even though I'm the co-founder of American Health Revolution, I am confused. I am confused. I don't know what to do, where to turn, right? Who do I trust? I mean, I have, my own antenna that I use, rightly or wrongly sometimes, but there's a lot of crazy stuff going on out there. One of the areas that I think is really emerging in a positive way, and we talked about this with Sylvia Fogel recently, and I think Irene Mavrakakis, Dr. Mav, who we both know, we talk about functional medicine as a path forward toward patient-first care versus the allopathic system, which seems, again, to have devolved into this sick care system. Do you have any thoughts on the functional medicine approach as a solution to where we're at?
Functional care practitioners are interested in the root cause of a condition versus just strictly diagnosis and treatment. So I strongly recommend that people seek out practitioners who have that type of approach, who are willing to consider, in addition to allopathic medical approaches, alternative approaches too. And keep in mind that other things could be very, very helpful. There are things that we can learn from traditional Chinese medicine that has been practiced for thousands of years that we don't use in this country, but we can start to learn from it and understand it. And that just brings us back to lifestyle issues. Having proper nutrition, staying away from ultra processed foods, which provide up to 60% of our calories every day, avoiding toxins, and engaging in some movement, some physical activity that's going to help our bodies stay strong, and getting enough sleep, dealing with stress, the usual things that we're seeing as recommended. And really, there's a need for people to be curious about what else can I do besides taking these medications for the rest of my life. What are the ways, let's say, that I could lose weight? We're in an obesity and overweight epidemic now. Are the ways that I could lose weight just by varying what I eat and seeing like which foods that I've been eating and I'm really addicted to, and I can make substitutions because if not, this is our future, where cancer rates are going to soar, the expenses are going to increase, and we this does not need to happen. We can reverse these trends, but it means that people have to take some initiative, have some curiosity, share information with each other, and look for ways to stay healthy.
Absolutely, very well said. And it is a shared responsibility, Richard. Right? We want to see things change at the institutional level, from the top down. We want to see health agencies that are motivated by patient first care. We want to see pharmaceutical companies that do the proper studies. We want to see the FDA incentivized for the right reasons. We want all of those things from top down, but we as patients, as consumers, as individuals, have to prioritize our own bodily autonomy. Like you said, learn to ask the questions. Curiosity is a huge asset. Right, taking charge, not being afraid to ask doctors. Okay, these are all things we have to do from the grassroots, from the ground up. So as the grassroots movement starts to gain traction, and as we put pressure on the politicians and the institutions to do the right thing, and not prioritize profit over patient, I think we can begin to see some change. It's not going to be easy. It's going to take time, right? It took us a long time to get here, right? And the entire system has to be we have to circle the entire system. It's not just healthcare, it's the food system, it's water, it's chemicals, all of those things that are leading to the proliferation of disease and cancer are contributing to the root causes. And that is going to be difficult to reverse, right? Especially when when they're just ringing their registers on the backs of human health.
I completely agree. And this is another reason why we need an American health revolution, because revolution comes from the word to revolve. To revolve is to turn around. And we need to turn this big ship around. It's not going to turn very quickly. And it needs to be pushed and pulled in different ways. But if we work together, I believe we can reverse our course. We can turn the ship in the right direction. There was something else I wanted to include in our discussion today.
Go for it.
People could go for. There's a certain metric called numbers needed to treat, NNT.
Mm-hmm.
And we could add this for people to see in the show notes too.
Sure.
And what it does, it gives people, if they go to the site, they could take a look at what exactly are the odds that a certain treatment is going to help them. And what goes along with that is another concept called numbers needed to harm. How many people will be harmed by this proposed intervention, whether it's medication or surgery, so that people could see numbers coming from the data that were produced either by the companies that produce the medication or coming from other sources, so that information can inform their decision. And there we are. Thank you for putting it up.
Mm-hmm.
That's
yes.
And again, this is something that I think that doctors should be offering their patients right in their office, so patients could see what are the what different condition they have, and what are the potential benefits, what are the potential risks in real numbers. Now, what Mark Twain said that there are lies, damn lies, and statistics. So statistics can be easily manipulated, but there's a concept called absolute risk uh, versus relative risk. And the absolute risk is the metric that you want to go by, that let's say only two of 100 patients are going to be uh, would be expected to improve through this recommended or treatment or intervention.
Richard, I've known you for 2.5 years, approximately. And in the time we've known each other, I have always experienced you as somebody who truly cares about medicine and patients, and really doing the next right thing. To me, you represent that segment of the medical profession that is good, that is honorable, right? And I think we can almost point to any profession and say, there's some that are sort of more, let's say, they have their North Star, they have their moral compass, and it's on straight. And so I think any solution that American Health Revolution offers is going to include you, your input, your wisdom, your knowledge, and I thank you. And we'll do more of this in weeks and months ahead. And I look forward to connecting with you again soon. Okay.
Thank you so much, Paul. It's a pleasure.
Thank you.